Dr. Ollie Bowe is a specialist surgeon in a university hospital. One of his areas of expertise is the surgical treatment of snoring. Some anti-snoring devices can be very simple, but others very complex. The majority of similar devices are available in drugstores or through direct mail. However, severe snoring can lead to the onset of breathing problems in patients, thus making them good candidates for surgical procedures. At the hospital where Dr. Bowe is employed, the participant has to cover some of the cost of the snoring device surgery. $700 for part of the cost for the surgery and $500 for the entire cost of the snoring device. An American medical device company has now asked Dr. Bowe if he would like to be involved in a trial to test the safety and efficacy of its new soft palatal implant procedure for reduction of palatal snoring. The soft palate is the middle part of the roof of the mouth. The anti-snoring device is an implant braided of polyester filaments. Dr. Bowe agrees to act as the investigator and starts to draft the informed consent form. There will be a participation fee in this clinical trial of $700 in total. This fee corresponds to the fee for the surgery that you have to pay even if you choose not to participate in the study, but instead have a normal, non-trial associated operation. However, you will not be charged for the cost of the test snoring device as a trial participant, a cost that would otherwise be $500. Upon finishing the consent form, Dr. Bowe submits it together with all other application documents to the local EC. Dr. Bowe is planning to initiate a snoring device surgical trial. The EC members thought that charging trial participants was controversial. After some discussions, the EC chair summarized, "It may be seen as appropriate by some, but not by others. In this scenario, the participant will be charged exactly the same amount for the surgery as for standard care. However, there will be no fee charged for the test snoring device, while there is such a charge when the surgery is performed within the framework of standard care. The charging arrangement seems to be reasonable since it has clearly been declared up front in the informed consent form and the patient has a choice of participation. However, charging for the test snoring device would not be regarded as ethically sound by many, since it is still a test article that has yet to be proven safe and effective and is provided free of charge by the sponsor. Note: one rule of thumb is that a study participant should not be charged for any examination, investigation, or treatment that has been covered by the budget for the trial, in this instance provided by a sponsor. Double charging is not acceptable.